Hello everyone, this is Dr. Spinach, and today we will be talking about bronchial asthma drugs in under 5 minutes. So let's get started. So before we understand the drugs that are used in bronchial asthma, it is also necessary for us to understand how bronchial asthma manifests or how does it happen. So when there is an entry of allergen, um, let's say through respiratory tract, that's when our B cells release IgE antibody, right? And then this IgE antibody acts on mast cells. Okay, now these mast cells, what happens inside these mast cells is the first thing, that is DNA acetylation. So DNA acetylation happens basically. DNA leads to formation of an enzyme called as phospholipase A2. So phospholipase A2 is formed, and then this expresses another enzyme that is called as lipoxygenase enzyme. So expression of phospholipase A2 leads to expression of lipoxygenase enzyme, and lipoxygenase actually leads to synthesis of leukotrienes. So we have leukotriene synthesis. So you can see these are bowls of leukotrienes that are synthesized. So bowls of leukotrienes that are synthesized, right? Now, next, what happens next is first you have an allergen entry here. So this is the first entry of allergen. Now, the second thing happens is when there is entry of allergen the second time, these leukotrienes are released. These leukotrienes then go and bind to their receptors. So these leukotrienes will go and bind to their receptors, for example, in the bronchioles of the lungs. So you can see here, I have drawn some small receptors for leukotrienes, and these are pink color leukotrienes that have been bound. Now, what happens when these leukotrienes bound to these receptors in the lungs is inflammation, which leads to bronchospasm. Now, bronchospasm can happen because of either binding to the minor bronchioles or major bronchioles. That means it depends upon what kind of disease we are dealing with in that case. So in asthma, usually the affected ones are the minor bronchioles, which have what receptors? Which have beta 2 receptors. Okay, and in COPD, the affected ones are major bronchioles, which have M3 receptors, right? So, or even in status asthmaticus, that is severe asthma, M3 receptors are the ones that are actually need to be reversed, because that is what is causing bronchospasm in cases of severe asthma. Okay, so and then that is how bronchospasm happens, and that is how bronchial asthma manifests. Okay, now what we can do is we can actually look at medications at each level of the process and try to block down the process. So let's finish looking at the medications that we can use. So we can block the IgE receptors, isn't it? So we can block these IgE receptors, not receptors, I'm sorry. We can block the IgE antibody by giving the monoclonal antibody here. So this is immunoglobulin that can be blocked by giving the monoclonal antibody. So this is known as omalizumab. Okay, so the next thing that you can do is you can block the acetylation and expression of phospholipase A2, which can be done using inhalational corticosteroid. So inhalational corticosteroids can lead to inhibition of DNA acetylation and phospholipase A2, and therefore inhibiting the process leading to leukotriene synthesis and leading to bronchospasm. So inhalational corticosteroids are also the drug of choice for maintenance treatment of bronchial asthma. Okay, the third thing that we can do is block the synthesis of leukotriene, and this can be done by using Zileuton. Okay, so Zileuton is basically inhibitor. I stands for inhibitor of leukotriene on effect. So leukotriene on effect, we need to inhibit that, which we can do by using Zileuton. Okay, the next thing that we do here, the important thing about Zileuton is the side effect of Zileuton, it actually deranges the liver function. So when you do an LFT, that will be deranged. So that's why it has been taken off from the market. The next thing that you can do is you can inhibit the release of leukotriene. So you can stabilize the membrane of mast cells. So these are known as mast cell stabilizers. So mast cells are also known as chrome cells, and therefore the drug that we use for mast cell stabilizers usually have chrome in them. So sodium chromoglycate. Okay, so there are three things that you need to understand here. One drug that is actually responsible for inhibition, for that is actually responsible for decrease in leukotriene synthesis or inhibition of leukotriene synthesis, that is Xileuton. Then there is one drug that is responsible for inhibition of leukotriene release, that is mast cells and stabilizers. And finally, there is another drug that will lead to inhibition of leukotriene receptors. So leukotriene, even when it's released, cannot act on these receptors. And these are montelukast and zafirlukast. Montelukast and zafirlukast. I'm pretty sure that you might have heard about these, right? So, and these are also the drug of choice for aspirin exacerbated respiratory disease. Exacerbated respiratory disease. The triad of this disease is known as Samter's triad, which consists of aspirin sensitivity, asthma, and nasal polyp. Okay, so remember these three. One helps with the inhibition of leukotriene synthesis, Xileuton. One helps with the inhibition of release, mast cell stabilizers. One helps with the inhibition of the leukotriene receptors, that is montelukast, leucast family. Okay, then finally, what we can do is we can block these receptors here. Either we can block beta 2 receptors or muscarinic receptors, right? Because in order to prevent bronchospasm, so you can give them sama or laba, that is short acting muscarinic antagonist or long acting muscarinic antagonist, depending upon what kind of disease you're dealing with. So these usually have tropy in their name, so ipratropium, tiotropium, right? The next one you can do is SABA or LABA, that is short acting beta antagonist and long acting beta antagonists. My bad. These are actually agonists, not antagonists. So short acting beta agonist and long acting beta agonist. So these are agonists. Okay. So this could be salbutamol or salmeterol. Okay, so beta agonists will help in relaxation of bronchioles. Basically, they will help in bronchodilation. So we are going to have agonist effect here, not the antagonist effect. And we're going to have antagonist effect here, not the agonist effect. So my bad, my correction. Okay. And we can also give magnesium sulfate IV, and we can also give theophylline. Theophylline basically is having theobromine, which is also a component of tea and coffee. So all the side effects you can see in tea or coffee intake would be the side effects that you see in theophylline intake. Okay, so that's all about bronchial asthma drugs. I hope you enjoyed it. I hope you got something out of it. There is definitely one MCQ that's going to come from this particular video. Okay, or you can say the drug. So thank you very much for listening to me, and you have a very, very, very amazing day.